Hi, this is Dr. Phil Smith. I'm excited to bring to you today Understanding MACRA and the Quality Payment Program. This is part one of a five-part series brought to you by healthitaccelerator.com. We're going to answer three questions on this video. Why should I care? What is MACRA? And what is the QPP? And as stated, I hope you'll want to know more and will continue on parts 2 through 5 of this series. A little bit about me. I've been in healthcare for 40 years. I'm board certified in family medicine and clinical informatics. I really started as a physician assistant, specialized in surgery before going to medical school and residency and going into private practice in the Tampa Bay area of Florida in a small town. I practiced for several years, and in 1993, automated my practice with one of the first electronic medical records in the state. From there, I really got the bug for informatics and decided to commit the rest of my career in working in this field. I spent 2 years with a major health IT vendor, electronic medical record vendor, doing consulting and implementations, and then moved on to be a chief medical officer for a hospital in the Tampa Bay market. From there, I learned healthcare operations and finally moved into the chief medical information officer space, where I spent 12 of the last 13 years working both in an integrated delivery network across multiple states as well as in a cancer specialty hospital. I'm the author of Making Computerized Provider Order Entry Work, which is published worldwide by Springer London. Why should I care about this topic? Well, the first thing I noticed was there are three myths out there that I've been hearing lately that I really wanted to address, and hopefully I'll answer your question on why these are such dangerous myths. The first is I am a physician who wasn't under meaningful use, so therefore QPP doesn't affect me. Second is it doesn't impact me now, so I'll deal with it later. And the third is, well, the president and Congress are repealing and replacing Obamacare, so this is going away, right? So if you're a physician, I want you to understand that this is a major change in how you're going to get paid and how much you're going to get paid by Medicare. It's already taken effect. And what you do in the 2017 year will really affect what happens to your reimbursement in the years 2019 and beyond, and creates an 8% payment gap for 2019 for not participating versus those who do participate and earn a reward. And that gap is going to grow over the next 5 years to a whopping 18% of Medicare reimbursement. So you'll have to decide what side of the reimbursement gap that you want to be on and either act this year and start getting rewards or hesitate, watch what happens, and perhaps get hit with some very hefty penalties. If you're a hospital or health clinic administrator, you'll need to know how each physician is affected by QPP and determine what their best program is for participation, because there are options. It's important to know what billing codes are included in QPP because some individuals who were excluded under the Meaningful Use Program are indeed impacted under the Quality Payment Program of MACRA. QPP can be filed by individuals, and it can be filed on behalf of a group practice under a single Medicare provider number. So this will eliminate for the multi-specialty or multi-physician practice a large amount of reporting requirements in that you can report as a group rather than at the individual level. And while minimal effort this year can prevent penalties for 2017, the 2018 year will be fully implemented and may take time to catch up if you do minimal amount in 2017. You may come to regret that in 2018. If you're a healthcare worker, you may be involved with data analytics, which will be necessary for compliance to report for this program. You'll notice that your efforts towards meaningful use for Medicare will shift to a new program called Advancing Care Information, or ACI, even though meaningful use will still exist under the Medicaid uh, payment system. You'll need to understand what the minimal components are to be successful with the ACI reporting. Also, your quality reporting will be done under a new name, Clinical Practice Improvement Activities, as several other reporting initiatives done in prior years are replaced by the CPIA. And if you're a patient, you'll ultimately want to know that this is about improving patient care outcomes. And though it's targeted towards the Medicare population, it's a good time to dialogue with your personal physician and understand how he or she is engaging in QPP and how you as a patient can benefit from that engagement. So what is MACRA? MACRA stands for the Medicare Access and CHIP Reauthorization Act of 2015. So Medicare covers adults age 65 and older and those with permanent disabilities through a federally funded health insurance plan. CHIP, on the other hand, stands for the Children's Health Insurance Program and covers children of a certain age category under age 19 for families with income of $48,600, though this can be adjusted in some states by their specific funding beyond the minimum threshold. And any U.S. citizen, including those covered under the DREAM Act, can be covered for under the CHIP program for pediatric services. But this talk today in this series will focus on the Medicare portion of MACRA, which is known as the QPP. So what is the QPP? This stands for the Quality Payment Program and is defined at the qpp.cms.gov. And there you can go and read the 820-page legislation, and there's a lot of visual aids and things to help you. But I'm going to try in this series to make it easier to comprehend, to save you some time and effort in getting the knowledge you need to be successful. In a nutshell, QPP ends the Sustainable Growth Rate, or SGR formula, which has set Medicare payments for physicians and provider services for the last few years. It's really a framework for rewarding physicians and providers for giving, quote, better care. And this is part of the move from the value-based paradigm of healthcare from the fee-for-service paradigm of volume-based care. So you're getting paid more for the outcomes and less for the number of patients that you actually treat. This also combines existing quality programs into one system. So these three programs are the PQRS, which stands for the Physician Quality Reporting System, Meaningful Use, which I already mentioned, which is the EMR incentive payments, and the Value Modifier, or the Value-Based Payment Modifier. It's important to know that MACRA is a law. It was passed in 2015 to eliminate the annual doctor fix that required Congress to revisit the Medicare rate under SGR and to put in a doctor fix to cover the growth in expenses of physician practices. And MACRA actually now has set the growth of Medicare fees to 0.5 percentage point annually. So note what I said, that this is a law, which means it's a statutory regulation and not an executive order. Also note, it was passed by a bipartisan vote of 92.8 in the Senate. So it would take a physical act of Congress to repeal this law. Also note that this is not part of the Patient Protection Affordable Care Act, or what we know as the ACA or Obamacare. MACRA is not targeted for repeal or replacement by the current Congress and has already taken effect as of January 1, as noted previously. So to understand what SGR is and its predecessor, MVPS, you'll see that Medicare fees to physicians has fluctuated greatly over the last 25 years. And the growth rates have included a couple of years in 1997 and 2015 when physician fees were actually cut. But you can see that starting in 2016, the 2016 rate has now been set, and 2017 is a 0.5% growth over the 2016 fee, and so on for the next 7 years. So if you look at that from a hypothetical $10,000 in Medicare fees for a doctor in 1989, and apply these growth rates for each year for that $10,000 of services, you can see the flattening of the curve starting in 2016, and that $10,000 of services today are delivered for over $40,000. But this leveling off is to stem the cost of growth of Medicare physician fees. So let's dig a little deeper into the QPP. So the CMS Quality Payment Program refers to the actual implementation of the MACRA legislation. So think of this as the working program. The final regulations were published in late fall, back in October, and as I said, have already taken effect. There are two paths to the Quality Payment Program. The first is MIPS, or the Merit-Based Incentive Payment System. This will be a new program which will allow physicians who have previously not worked in accountable care organizations to find an entry-level program to help them build into this incentive program at a pace that they can handle. Alternatively is the alternative payment models, or APMs. As stated, this is for people who have already done existing ACO, or accountable care organization models, patient-centered medical homes, and will allow further pilots into areas like oncology, patient-centered homes, and end-stage renal disease homes for patients on hemodialysis and chronic dialysis. Now, notice that the law says participation by physicians in these two models is voluntary, but non-participation in 2017 sets you up for an automatic 4% penalty in 2019, escalating to a 9% penalty by 2022 through 2026. But there's a lot more to learn, and that's why I want to direct you to parts 2 through 5, where you can learn specifically more details about these programs. So please visit us at healthitaccelerator.com. I hope you enjoyed this presentation.